TRX rows are one of the sloppiest exercises out there, right? There's a lot of degree of freedom for a lot of compensations to occur. Normally, we have patients that do this where their hips are leading and they're in a ton of extension, or they're going into way too much shoulder extension and they end up with pain at their shoulder. Well, in the physical therapy world, if we are using this exercise to get someone out of pain, then we need to be really strategic as to how we want to coach them through this movement. So A, we don't cause additional pain, but B, we can use it in a way that starts to decrease their pain. So in this video, I want to go over 3 steps so that you can really coach a TRX row confidently to help your patients get out of pain. The first step is trajectory. It's really an unfamiliar motion for a lot of patients, right? We're working back muscles, and it's something that you don't have that direct feedback compared to a leg exercise, right? And so that's why our coaching cues and really putting strategies into place to set them up for success goes a long way. So the easiest way that I like to help them understand the trajectory or the way that they need to move their arms is by referencing a triangle. So all I do is to have them put their arms out, and as you can see from this view, my arms are in a triangle, right? So my hands are the tip of the triangle, my left shoulder is the one base, the right shoulder is the other base. And as we move through the trajectory, we move like a triangle does. So at the top of the motion, we're at a triangle, nice and narrow at the top. And as we pull, we get wide. But this is where the triangle comes into place. They need to continue this widening trajectory because a lot of people will either suck their arms right against their sides, and then they usually end up in a position that's too rolled forward, or they move like a rectangle. And a rectangle is here and then here, here and then here. And it's almost 2 motions. So we really want to strive to coach them with a triangle. Here's what I'm talking about as it relates to the starting position. So triangle, narrow at the top, we get wide as we pull, we end in a nice wide position where our wrists are right over the elbows. A lot of times people want to almost flex their elbow like they're doing a bicep curl. And the problem is they're probably going to overload their bicep and or their shoulder and not really feel it where they're supposed to feel it. So narrow at the top, pulling wide just like a triangle does, and then we go back and repeat. Step number 2 is isometrics, extending through their hips, so essentially they aren't using their shoulder blades, and then ending with a poor position at the actual shoulder. So the easiest way that I like to combat this, especially for new patients that have not performed a TRX row, is just do isometrics. It's really going to help them with 2 things. It's going to, 1, help them understand where they should feel it, right, in their shoulder blade, not so much that anterior shoulder, but also how do we do it in a way that maintains the proper pelvis and hip position. So it's just an isometric row, right? So we do our triangle, we pull up, the wrist is over the elbow, I'm not in internal rotation, I feel my shoulder blades engaged. We then can kind of move the hips to show them right versus wrong, but the whole time they're maintaining this shoulder blade contraction. And like I said, the rows are tricky. They're not familiar with these muscles and it's harder for them to feel it. So take the time in the beginning to really go through these isometrics, hold that position, make sure they know what should be working and how the hip should be positioned. And that way, when you start moving faster, they'll be able to quickly decipher between right and wrong. Step number 3 is walking down. Then we talked about isometrics so they can understand what should be working. Now we're going to maintain that isometric and walk down. So what is this doing? This is increasing intensity. So they are going to have to maintain their proper position at the hips like we talked about, but also maintain the shoulder blade contraction. So all we do, we go through our steps, our triangle, arms and shoulders are in a good position, hips are in a good position, then we're just walking down. And this is an easy way to increase that intensity. The lower we go, the more the shoulder blades must work. Notice how I said must. They must work because if they're maintaining that hold, they should kick in more. And then we walk back down. What you'll find is a lot of people want to raise those hips up as they go down. And this is the perfect time that you can coach them on the proper position. So going through these 3 steps, the trajectory with the triangle, the isometrics to feel it, and then increasing that intensity should really help your patient perform the TRX row correctly the next time they're performing it in a much faster pace.